Just to say, if you see things strange in the background, ignore it. I deal with.
We are going live. Mute yourself, please, Goku, please.
Hello.
So Timbuktu, Ghana, Mali, Sumanguru, you know what you're shown. What you're shown. So Timbuktu, Ghana, Mali, Sumanguru, you know what you're shown. Manchester, you know Sumanguru, you know what you're what you're shown. What's that to do, you know? Bamasa, you know. Yasan, you know what you're shown. Get your Israel, get your Ethiopia, get Sudan, what you're shown. Akwaka, Bajimo, one year, I forget a chap. I got you one year, and in your fame. Akwaka, Bajimo, one year, I forget a chap. I got you 1 year, and in your fame. I'm a Caminian Matu, I'm a Caonian Motu, I'm a Caonian Watumo. I'm a Caminian Matu, I'm a Caonian Motu, I'm a Caonian Watumo. I'm a Caonian Watumo, we not a catch more walk, Wabanya. Can you change inside your mama? Can you change inside your mama? Can you change inside my mama? Can you change inside your mama? Your mama, if I change inside your mama. What you do, what you need, can you change inside my mama? What you do, what you need, when I do not my mama, yo. Can you change inside my mama? Can you change inside your mama? Can you change inside your mama? I walk out back to my 1 year, I forget a chap. I get you my 1 year, I know you're fake. I walk out back to my 1 year, I forget a chap. I get you my 1 year, I know you're fake.
Boss in Europe. Let me join Tap Send.
That you guys see, I'm in Spain. I'm in Madrid. Oh, and Tap Send is having a double referral bonus promo. You don't know. That's why I'm here. So me too, I'm going to refer people in the USA and I'm going to get double my promo bonus. So meaning, if you're in the USA, you can also refer people in USA and you'll get double your referral bonus. If you are in Canada, you can do same. If you are in UK, you can do same. If you are in Europe, many countries in Europe, you can also do same. So join this promo, and this promo starts from now and ends in October. My brother, don't go. And it's double the promo bonus.
Download Tap Send now on Google Play and App Store. Tap Send. It's secure, convenient, easy, and fast.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Are all student association contributions?
Even the money from the fundraiser for Kweku's surgery.
Oh! He too! Don't be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
At Diaspora Insurance, we understand the importance of dignified send-offs within Ghanaian culture and traditions. We also understand that you want to avoid the double trauma of your family grieving and not having the financial support to cover funeral expenses when you are not around. With our Diaspora Funeral Cash Plan, you can now cover yourself or your family in Ghana or abroad. With no medicals required, we'll accept you if you are under 75 years. Visit our website today or call us to complete simple form in under 5 minutes. With Diaspora Insurance, your peace of mind is guaranteed.
Good evening, audience. Welcome to tonight's edition of the Ghanaian Community Awareness Forum. My name is Nana Kwesi the First of Ahanta Traditional Area and Chairman of Ghana Union. We are here tonight to have a bit more education about some of the things we can do to help improve our metabolic health. As always, this platform is for all of us to educate, inform, and make ourselves aware of some of the things that we should know of or we can learn from others. We are grateful to TapTapSend for their continued support to this forum and helping us bringing it to you live. We are grateful to IT Consortium for all your IT needs. Contact them, go online, check their details, and liaise with them. They are very helpful. And of course, grateful to Diaspora Insurance. Make hay while the sun shines. Do not leave things for the last minute. As a community, we need to be there for each other. And when that time comes, a little bit of extra financial help could go a long way. So patronize their service so they can also support us. As always, this forum will not allow you to mute yourself until you are called to speak. Today's discussion is about metabolic health, and we'll be addressing issues around diabetes, obesity, blood pressure, any other major health-related conditions. Please feel free to answer your questions. You are not going to be taken on for asking any question. It could be you are here to listen, to tell your family member about something. So it doesn't necessarily mean when you speak, we will identify you as anybody in any of those categories. It's just a question and conversations time. We have tonight with us a qualified pharmacist who has been in practice for a long time, someone who knows her job and has done so in many respects. She's a pharmacist and an interim head of medicines management for North and Central London Integrated Care Board, Harlingay Clinical Commission Group, an NHS person who has been on in the NHS field for a long time. I will not say much because I'm going to give her a chance to say a bit about herself at some point. But we have tonight Ifa Moti, who will be here, who's here already, to educate us about what we can do to improve our metabolic health. Ifa, I'm done. Please unmute yourself and take over so we can run the show to our many audience with us tonight.
Thank you, Nana, so much for that wonderful introduction. Before I start, I just want to say a little bit about myself and my journey and what brings me here tonight. So as Nana said, I've been a pharmacist for over 30 years. 10 of those years I spent in what we call secondary care, which is hospital, as a clinical pharmacist. And I've worked in many specialities. Since then, the last 20 years plus, I've worked in what we call primary care. And I am now a head of medicines management and I work with a team of pharmacists, and we advise GPs on prescribing. We help them stay within budget and also make sure they stick to formularies to treat certain conditions. And before I move forward, you know, when people think of pharmacists, you just think of like the community pharmacist, the person in the shop. I want to plug our profession a little bit. There's so many avenues to being a pharmacist, where we work in primary care with GPs. Some of us are helping the GPs prescribe for patients, we're seeing patients. So when your children want to choose a career, you know, make sure that they do consider pharmacy as well. So that's just my little plug. Okay, so I was actually born in the UK, but I had my secondary education in Ghana. And growing up in Ghana, in my community, I saw many relatives, aunties, uncles, all develop long-term conditions. And I felt it was a prerequisite. And I believed strongly at the time when I was young that it was probably because we were very sedentary, we didn't exercise. So roll on to being a pharmacist for maybe about 20 years or so. I came and I decided that I would not be that kind of person, and I would take up exercise, and I thought that would help prevent me from developing a long-term condition. So that was my strong belief until about 2017, when although I was running about 5K a week, I was exercising frequently at the gym that had just opened. I still couldn't keep off the symptoms of pre-diabetes and hypertension. Went to see my doctor, and he said, for people like you, which I don't know if he meant my race or just general people who develop these symptoms, he felt that it was very important that they would start medication early to stave off these conditions for much longer before I eventually succumbed to getting full-blown diabetes and hypertension and all the complications that went with it. So then I was quite surprised. I was really shocked and disappointed in myself and in the system, because I had done everything that was expected of me. I felt I had a healthy diet and I was exercising as well. So I said to the doctor that, you know, I'm going to go away and do my own research and come back, but I would politely decline the medication for now. And then he said to me, good luck. And I did. I went and did my own research, and I stumbled across a community of people just like me who had started developing what we call metabolic syndrome. And I'm going to go into that. But they found an alternative way to deal with it. They were very active. Some of them were actually running marathons every month. Now, you can't be more healthy than that. So this evening, what I want to do is I want to share with you what I found, and I'm going to explain the science behind it. I'm going to try and make it as simple as possible. And I'm going to teach you how you can do it yourself and turn your life around, and then also offer my services to you if you feel you might need some help to do so. I'm going to share my screen now and start the presentation. Okay. Right, okay. I hope you can all see the presentation. The first thing I want you to do is to note the phone number here. Just now, just take a note of it, because you never know when you come to the end, you might find it very valuable and will need it. It will be on all the slides as well. So just a disclaimer, I'm a health and wellness coach, and what you see and hear tonight is not intended to diagnose, treat or prevent or cure any disease condition. It's not intended to substitute for the advice of your GP, so do not substitute what I tell you here for what your healthcare professional tells you. I will be sharing information that I've gathered from others, and I would advise you to do your own research on the subject. And as a pharmacist, I'm always happy to be privately contacted for your medication to be discussed. And if I identify anything that needs to be changed, I would advise you to see your doctor. Now, this red box here is just reminding me that there's a few quiz questions in the presentation, and I will be calling on you to answer. So I want you to pay attention so you can answer. Right, so I talked about metabolic syndrome. This is diagnosed when someone has 3 or more of the following risk factors. So a high blood sugar or glucose. I'm going to use these 2 words interchangeable throughout the presentation. So blood glucose and blood sugar is going to be the same thing. Low levels of the so-called good cholesterol, that's HDL, and high levels of triglycerides in your blood. A waist circumference that is quite large. So if you're apple-shaped, then that is classified as a risk factor for metabolic syndrome or high blood pressure. So if you have any 3 of these, you would be classified as someone having metabolic syndrome. Mostly these all work together. You know, you have high blood pressure, eventually you develop diabetes and vice versa. Okay, so these are the problems associated with metabolic syndrome. So obesity, heart disease, lipid problems, that's just cholesterol problems, blood pressure, type 2 diabetes, as I've mentioned. Dementia is often referred to now as type 3 diabetes, some cancers, polycystic ovarian syndrome, and non-alcoholic fatty liver disease. Now, I just want to talk about non-alcoholic fatty liver disease for a little while. When I started working as a pharmacist in the hospital, most of the patients who were admitted who had fatty liver disease were alcoholics. But right now, 30 years on, we're seeing that most people waiting for a transplant due to fatty liver disease are not alcoholics. So that's why there's a differentiation between alcoholic fatty liver disease and non-alcoholic fatty liver disease. You must be asking yourself why this drastic change in people on the transplant list waiting for the transplants with liver disease that is not caused by alcohol. And we'll go into that. So here I have the slide. Everything in green is what you can develop from metabolic syndrome. The orange boxes is what conventional medicine will recommend as a treatment, and the blue box is the course. So we're going to go through them one by one. If you have lipid problems, your GP will suggest you start a statin, and there are other medications that you would go on as well. If you're overweight or you're suffering from obesity, they would recommend a low-fat diet, exercise, and possibly if you reach the level of which the NHS deems like morbid obesity, you will be offered bariatric surgery. And I think you know what that is, when they cut part of your tummy off or block off part of your stomach so you stop absorbing so much nutrients and then you lose weight. So for cancer, you will be offered surgery, chemo, radio or hormonal therapy. For diabetes, there's a host of anti-glycemic medicines and more are coming on the market. They're very expensive. For blood pressure, I've just listed the classes of the blood pressure agents here. I think most people will know amlodipine, but there are so many classes and so many combinations that one can be on. Now, if you have dementia, we can only treat moderate to mild to moderate dementia. If your dementia is severe, there's no medication for you. So if you have mild to moderate, they will give you one of these 3 drugs. So that's in this box here. For polycystic ovarian syndrome, it's metformin. For sleep apnea, breathing apparatus. And as I said, for non-alcoholic fatty liver disease, there's actually no treatment. But if it becomes very bad and you get cirrhosis of the liver, you go on a transplant list and you get a liver transplant. Now, all these conditions are caused by what's in the blue box, which is insulin resistance and hyperinsulinemia, and I'm going to talk you through that. What if we could just treat the insulin resistance and hyperinsulinemia? What if you had 3 of these conditions? Can you imagine the amount of medication you would be on? So rather than, treat the condition, why not treat, the cause? So we're going to have a look at the cause and how we can treat it. We're going to focus on insulin. When I speak about insulin, as soon as I mention insulin to people who are not familiar with this, they're like, I don't have diabetes. Insulin is not just linked to diabetes. Insulin is an essential hormone. It has many roles in our body. We cannot live without having insulin in our body. Many bodily functions are dependent on insulin. Without insulin, it's very fatal. That's why when insulin was discovered, like in the 60s or so, that was such a groundbreaking discovery, and that many people have survived due to the discovery of insulin. Insulin is important for transporting glucose into our cells for energy. Insulin also signals the liver to store blood sugar for later use. Insulin is very, very important. We need it. But now I want to talk about the causes of this metabolic syndrome, which is insulin resistance and hyperinsulinemia. Okay, so insulin resistance is when the cells of your muscles, fat, and liver do not respond to insulin well. And then your cells cannot take up the glucose well. So that's insulin resistance. The cells are not responding to insulin. They don't open the door to let the glucose in. Insulin is like a key. It opens a door to glucose in your cells. And then when that key doesn't work, it's what we call insulin resistance. Hyperinsulinemia is when the amount of insulin in your blood is higher than what is normal. So how does this develop? Okay, let's say we start eating foods high in sugars. We have a constant high blood sugar, and therefore constant high insulin, because remember, we need that insulin to open the key of your cells to let the blood sugar in. Okay, so these are the high insulin comes from the pancreas, which is this yellow thing here. That's what the pancreas looks like. And these are all the different body cells that we have: neurons, muscle cells, endothelial cells, whatever cells you have in your body. We need insulin to open that cell so that the blood sugar can go in. But when there's too much insulin in the cells become resistant to that insulin. So this leads to high blood sugar, nowhere to go, high insulin levels. Your cells are starving, the sugar cannot go in, and that makes you feel hungry and you crave for more, and you just eat more foods high in sugars, and the cycle goes on. And this is how we develop insulin resistance and high insulin, which is the hyperinsulinemia. It's just a very complicated long word, but it's just high insulin. Right, so the first quiz comes up. What do we know about insulin? And I've told you all the answers, so you just think about it in your head, whether it's true or false. Does insulin allow glucose to enter cells to be used as energy? Is it a growth hormone? Is it associated with the regulation of blood pressure? Is it only injected insulin that can cause weight gain? And here are the answers. Yes, it's true. Insulin allows glucose to enter your cells. Insulin is a growth hormone. We're going to come on to that. And it also regulates blood pressure. And it's not only injected insulin that makes you put on weight. If one has diabetes and the doctors say it's time for us to start insulin, people are worried because it makes them put on weight, which it actually does when you start injecting it. But also your endogenous insulin, the one that you make yourself, makes you put on weight. Right. So where does the sugar or glucose in our diet come from? Now, this is made, the sugar comes from only 3 molecules. So the first one is glucose. Everybody knows about that. I'm sure you know about fructose, which you get from fruits, and galactose, which you get from milk. So the sugar, the white sugar crystals that we see is called sucrose, and it's made up of 1 molecule of glucose and 1 molecule of fructose. Now, milk sugar is made up of 1 molecule of glucose and 1 molecule of galactose. So when you're drinking like large quantities of milk, there's sugar in it too. Okay, so starch molecules are just many glucose molecules holding hands. And, you know, we talk about low GI starches and high GI starches. And we say, well, the low GI starches are better for us than the high ones. So you can find low GI starches in some fruits and vegetables, in pulses, in whole grain foods and porridge oats, for instance, and high GI starches can be found in sugar, sugary foods, sugary soft drinks, white bread, potatoes, rice, and anything really that's white. So how much sugar is found in common foods? Now, people, when I speak to people about sugar, they're like, yeah, I don't take sugar, so I'm fine. But one thing that we have to know is our body has to break foods down, carbohydrates down into sugar molecules before it can digest it. So whether you're taking a teaspoon of sugar or you're eating white bread, it's still, your body only sees it as sugar. So here we are. When you look at 150 grams of white rice, when you eat that, your body sees that it has to break it down into the glucose molecules, and that is equivalent to 9.6 teaspoons of sugar. Brown rice, when I often say to people that, you know, we need to change the way we eat if we want to heal ourselves. So yeah, but I'm good. I only eat brown rice and whole grain food. Brown rice, 150 grams, is equivalent to 7.3 teaspoons of sugar, not much. And even that, I've had people wear a glucose monitor, and they've tried white rice and brown rice, and the change in blood sugar between the 2 spikes is very minimal. And again, for white bread and brown bread, look at the teaspoons, 8 teaspoons for white bread, and 6 teaspoons for brown bread. And it just goes on, spaghetti and brown spaghetti. But look at broccoli, hardly any sugar in broccoli. So note, our bodies do not differentiate between sugars when they're ingested. You don't add sugar to your food, but when you eat carbohydrates, your body is going to see it as sugar. So let's understand the physiology of nutrition, how food affects our blood sugar. So if you are healthy and you don't have an intolerance to glucose, or you're not pre-diabetic, which is an intolerance to glucose, or you're not diabetic, when you eat carbohydrates, your blood sugar will spike, and within 2 hours, we would expect it to come back down to normal, 2 hours. When you eat protein, there's less of a spike. That's the blue line here. Here we are. And when it's fat, there's hardly any spike. So your body digests highly processed, high carbohydrate foods very quickly, and that's what causes your blood sugar to spike. When your blood sugar goes up really high, this puts extra stress on your pancreas to produce the insulin, which will help bring that spike down, because having high sugars is dangerous for your body. So your body is always striving to bring the sugar spike down to a level that is safe for you. And over time, if you have high sugars for a long time, this is what we call insulin resistance. So what's insulin's role? To keep our blood glucose levels in this very, very tight range that I talked about. So for an average adult, we have about 5 liters of blood in our system. And within that, on an optimal level, we only have 1 teaspoon of sugar in our blood. That's optimal, and that's how your body wants to operate. So let's say you wake up in the morning and your blood sugar is in the optimal range, 1 teaspoon, and then you have some cereal with some milk. Your body sees that as, whether you add sugar to it or not, your body will see it as sugar, and your blood sugar is going to spike. So we come up here to number 2. Once your blood sugar spikes, the level is now too high for optimal functions of your body, and insulin will also spike to help push that sugar back down to the optimal range between the 2 dotted green lines. But because insulin is high, it pushes the level of sugar far too low, and that brings it down to number 4, where your blood sugar level has crashed, you feel tired, and you just feel irritable, sometimes maybe depressed, and you feel you need a snack again, and then you take another snack. So you snack to feel better, and then you go up to 0.5 again, insulin is released, pushes it back down, and so forth and so on, and it keeps going on. And then the net result is mood swings, depression, and weight gain. And I'm going to come on to explain to you how the weight gain happens. So let's look at carbohydrate meal frequency and blood sugar levels. So let's say you just stick to 3 meals a day. You get up in the morning, you have your breakfast, and then your blood sugar rises, which is the green line. Once your blood sugar starts rising, it triggers off the insulin to bring it back down to that optimal level. Remember the optimal level I spoke about? And then you wait until lunch, you burn all that energy you have, and then you have another meal. And again, your blood sugar rises first, and then the insulin rises, and so forth and so on. And then in the evening, you have your 3rd meal, and hopefully will bring it down, and then you go to bed. However, is that how we eat? Not really. Sometimes we have breakfast in the morning, and then around 10:30, 11, we have a snack. Could be a Mars bar, who knows? And then, so when our blood sugar goes up, when we have the snack, it doesn't come back down to the optimal level, and the insulin is high, still trying to do its work, but then we have a snack. And then our blood sugar goes up, insulin goes up as well. And then it's soon lunchtime, and we go and get some lunch, and the blood sugar goes up again. And then around 3 o'clock, we're feeling, a bit tired, we want something to pick us up. We have another snack, and that goes up. And you can see that the insulin, which is the gray line, is always high. It's never really coming right down. So by the time you have dinner and then an evening snack before you go to bed, you've had insulin high all day. So that's what usually happens. Okay, so we've come on to our second quiz, and I hope you can remember the answers. What's the optimal amount of sugar in our blood? 5 liters average adults. Is it 4 tablespoons, 4 teaspoons, 1 teaspoon, or 1 tablespoon? What food group increases insulin production the most? We talked about that. Is it protein, fats, carbohydrates, vitamins, or minerals? And in a healthy person, how long after eating would you expect sugars to return to normal? And here are the answers. So it's 1 teaspoon of sugar. That's when your body's most happy in the blood. So if it goes any high, you're going to have to produce insulin to bring it back down to that level. It's carbohydrates that increase the production of insulin most. And in a healthy person, it's after 2 hours, we would expect your blood sugars to return to normal level. Okay, let's talk about insulin and diabetes. How does this develop? So diabetes takes a very, very, very long time to develop. And what happens is, you go and see, I'll just talk about the lines first. Let's start with the lines. So the red line is our insulin resistance, the time it takes for us to develop insulin resistance. The black line is the amount of insulin produced by our pancreas. And the green line is our fasting blood glucose. When you wake up in the morning, what is your blood glucose level. So as long as it's around 5.6 or lower, then you're fine. When you go to your GP and they do a fasting blood glucose in the morning before you've eaten, it always seems to come back, quite low. And then the GP is like, yeah, yes, you're fine, what have you. However, if you look at the black line, that's the amount of insulin. You can see that over the years, we are requiring more and more insulin to keep our blood sugar at the level that our bodies want it to be. And whilst we are using, oops, what's happened? Can you still see my screen? Yeah, okay, fine. So what happens is over the years, as we develop insulin resistance and our cells start getting resistant to the insulin, we are requiring more and more insulin to keep that level down until it gets to a point where we are fully insulin resistant and our pancreas can no longer pump out this huge amount of insulin. The beta cells in our pancreas start dying off and we're producing less insulin. And it's at this point when our HbA1c is 4.8 millimoles per mole, that's when you're diagnosed to have diabetes. Now, this takes 10 to 20 years to develop. And so in that time, before you're diagnosed to have diabetes, your blood sugar is normal. And that's because the high level of insulin was masking the effect of the insulin resistance. Now, this is just another diagram to help you understand insulin resistance. So when you're young and healthy, see the amount of insulin you need to keep your blood sugar normal. However, after years and years of high carbohydrate consumption, you will need you will need more insulin to keep your blood level normal. That's just trying to make it more simple for you to understand. You've got all this insulin now. It's much more than what people who are not sick would have. And this is what we call hyperinsulinemia, high insulin levels. Okay, right. Now let's talk about insulin and obesity. Now, many people think they're ill because they're overweight. No, you're not ill because you're overweight. Being overweight is a sign of being ill. So don't blame it on the weight. If you're overweight, that means that there's something not working well in your system. Okay, now let's talk about obesity, insulin and obesity. So insulin regulates fat storage, okay? When insulin levels are high, it stimulates the fat cells to take up glucose and turn it into fat when insulin levels are high. So if you have a lot of glucose in your body, you produce a lot of insulin and the insulin will store that blood glucose as fat in your cell. As I told you, insulin is a fat storage hormone. When our bodies are exposed to unrelenting supply of glucose, insulin is constantly high, and this is what we call hyperinsulinemia. I'm sure you've understood it by now because I've said it so many times. And fat cannot be burnt in the presence of high insulin levels. And this is just an example here on the right-hand side. And these unfortunate people have had to inject insulin constantly over the years. And you can see at the injection sites, they've developed fatty deposits. And that's because in the presence of high levels of insulin, you cannot burn fats. Right, okay. So how do farmers fatten their cows? This is just trivia, but it is actually true. I Googled this because it just occurred to me that how do they fatten cows? And it says you should use barley. It's the best grain for feeding cattle to make them fat. You can use wheat, or you can use something called triticale, which is wheat and rye hybrid, sorghum, maize, and oats. Yeah. However, we eat cereals in the morning thinking that when we have like cereals for breakfast, we are going to lose weight. But no, if cows are being fattened by cereal, we will be fattened by cereal as well, because we are all mammals. Right, okay. So insulin and blood pressure. Constantly high levels of insulin cause the kidneys to reabsorb sodium. And when salt is reabsorbed, which is sodium, so does fluid follow it. Fluid follows salt wherever it goes. In your arteries, we have hormones that are increased by insulin, and they cause vasoconstriction, so they make your arteries very thin. And you know, in a hose pipe, if the hose pipe is very thin, then the pressure goes up, doesn't it? Insulin also stimulates nitric oxide, which is used to relax arteries. But if your artery cells are insulin resistant, it won't work properly, and it will make the artery stiffen and your blood pressure will go up. And there are just many other mechanisms, very, very complicated, but the net result is a high blood pressure. So this is the last quiz, and then we go on to other things. So how long does it take to develop diabetes? Is it 1 to 2 years, 10 to 20 years, 3 to 4 years, or 3 to 40 years? What role does high levels of insulin play in our bodies? Does it help us burn fat, store fat? Does it help us lower our blood pressure? Or does it remove sugar from your body and store it in your cells? And the third question is, how does high levels of insulin affect blood pressure? Does it make the kidneys retain fluid? Does it make the kidneys retain sodium? Or does it lower your blood pressure? And these are the answers. 10 to 20 years to develop diabetes. And this is really important because, you know, when we speak about health, people say, well, I'm fine, I don't have diabetes. We don't know where we are along the spectrum of developing insulin resistance and hyperinsulinemia, because that's not a test that your GP ever does. Okay. Again, insulin helps us store fat. When our levels are high, we will be in fat storage. And insulin removes sugar from the blood and stores it in our cells. And it only does that because high levels of sugar are not good for us. Insulin also makes the kidneys retain fluid and sodium. Now, how can you check whether you have hyperinsulinemia? A really good test is, because I hear many people, as I said, say, well, I'm just a tad overweight, all my blood results are in range, my blood pressure is just under 130/80, my blood sugars are in range. And however, you can tell whether you have insulin resistance if your height is less than 2 times your waist. So what you do is you measure around your waist, and if you multiply that by 2 and it's higher or longer than your height, then you know that you have insulin resistance. So forget BMI. I think this is just the easiest way to tell how healthy you are. I'm going to say it again so you understand. Take a tape measure, measure around your waist and find what that number is. Multiply it by 2. If that number is taller than your height, then you know you have insulin resistance. That's a simple test. Right, okay. Here are other signs that you're insulin resistant. So for men, if you have a waistline of over 40 inches, and for women over 35 inches, if your blood pressure reading is greater than 130/80, if your fasting insulin level, that's when you wake up in the morning without eating, is over 5.6 millimoles per liter, there's certain blood tests that your GP can do. And if you have skin pigmentation changes, so if you have skin tags, which is on the left, or acanthosis nigricans, which is in the middle. And this is just dark velvety patches on your face, in your groins areas and under your armpits. Or if you have something called xanthelasma, that's these white things growing by your eyes. These are all signs of insulin resistance. And I can tell you, absolutely. For the first two on the left, if you change your diet, your lifestyle, these things clear up. I think that xanthelasma, those need like minor surgery to get them removed, but the other ones can definitely be reversed, and I have seen it being reversed. Okay, what are the symptoms of hyperinsulinemia? So weight gain, obviously, craving for sugar, intense hunger, hungry. That's what they call hungry. You know, you get to a point you're so hungry that you can't concentrate. You have to go and find something to eat before you can come back on work. That kind of feeling. Difficulty concentrating, feeling anxious or panicky, lacking focus or motivation, and feeling tired, especially after eating. So what would good health look like for you? Able to move more freely without pain, probably exercise, your clothes fitting better. So many people, when they start my course, by week 4, they're telling me their clothes are fitting better. That is absolutely amazing. Less visits to the doctor, reduced pain, improved blood pressure and diabetes, less pills maybe. Able to play and look after your grandkids. And I say that because it's rather after the age of 50 that we start experiencing insulin resistance and we start having all these problems. And that's when our children are probably getting married and start having children themselves. So you want to be active then. And to sleep better, absolutely, people report that they sleep better, and also to breathe better. People do huff and puff when they're carrying extra weight, and it's just really difficult. Okay, all right, now let's go to the exciting part of the talk, the hope that we can change this around ourselves without even using pills. So I bet this is what I'm going to talk about now. So as I talked about it before, we can tackle insulin resistance, which is the cause of all these problems. In this tree, there are things like osteopenia, heart disease, erectile dysfunction, stroke, inflammation. Absolutely. This is one thing that people complain about all the time, and pain in their joints, just by tackling insulin resistance. Okay. And this is a lifestyle approach which looks at the root cause and tackles the root cause. And other things that cause insulin resistance are chronic stress, the highly processed foods that we're eating, lack of sleep, sedentary lifestyle, and seed oils. But in this talk, I'm just going to focus on the nutrition parts. Okay, so there are 3 main ways of tackling insulin resistance. So I think about maybe 5 years ago, when the NHS approved bariatric surgery to treat obesity, we found out that patients who went through bariatric surgery started reversing their diabetes and their long-term conditions. So absolutely, that is a way to go. If you feel that you just can't tackle it on your own, and you do meet the criteria for the NHS to have bariatric surgery, but it is very, very risky. Another area that is now approved on the NHS is following very low calorie diets. Now, we offer that in my ICB where I work, and you will be on a specially formulated Nutri-Complete shake for 3 months. You will take these shakes. You'll take the shake, the 800 calories is divided into 3, and then you take them 3 times a day. I think you are allowed to eat leafy greens, but honestly, that is it's so difficult to follow. And we're really struggling to recruit people because you'll be hungry like all the time. Your body probably gets used to it, but it's not sustainable, because you're not going to do it for life. And often when people come off the shakes and they're supposed to have like health coaching to make better choices in their diet, which they probably don't, and they go back, then the weight comes back. And someone told me it actually comes back with interest, which is not very nice. And then the third one that I'm going to focus on tonight is the therapeutic carbohydrate restriction. And the success depends on understanding the approach, being adherent, especially in the first month, because it's quite difficult. Any dietary change is difficult, and it's good if you can get support to do it. Okay, so high insulin levels can be controlled or reduced by lowering your carbohydrate intake gradually over 2 to 3 weeks. And I say gradually because if you make drastic changes, it's very difficult to maintain. Whilst you're lowering your carbohydrate, you're reducing your calorie intake, so you must supplement it with something else. You increase healthy fats in your diet and make sure you eat adequate protein. Most people are not eating adequate protein. You will keep your carbs low for at least 1 to 2 months so that your body can adapt. And that's when we call that you have a fat adaptation, because your body now starts learning to burn fat as fuel instead of the glucose that it was using for all those years in the past. It takes a while, but the body is an incredible tool. It just knows what to do, and it absolutely does work. And then you only eat when you're hungry. And for most people, this is twice a day or even less, once a day. And I'm telling you these now, but it absolutely does work. People find it very, very difficult to believe it works. And when they start my course, like now the group I'm running, we're on week 4, and people are, and some people even in week 2, they start reporting less hunger. It's not a loss of appetite. It's just your body realizing that, oh, I don't need glucose anymore, and I'm carrying all this fat, and I will use that for fuel. So you start burning your own fat as fuel. So then when you start burning your own fat as fuel, you can reduce the added fats to your meals. And then eventually you will get to a level where you can find your own carbohydrate tolerance. Right, so people say, so what can I eat? So we won't be eating any of the foods on the left, and that includes honey, because people feel honey is really healthy, but we can come to that at a later date. What you will be eating is real foods. Now I say to people that eat foods that your great-grandmother would recognize. She wouldn't recognize like cornflakes in a box or all sorts of, just things that you know are real food. That's what we're going to focus on. And in the bowl here, we have coconut oil. And so we talk about healthy fats and oils that you should be using. You have to check food labels for hidden sugars. There's like 56 different names for sugar, including honey. And we have food swaps on the therapeutic carbohydrate restriction diet. So for instance, white rice, you could use cauliflower rice, grain flour, coconut flour, pasta, spiralized, courgettes, fizzy drinks, you would use infused sparkling water, and there's just a whole lot of others. I won't go into that too much because we want to hurry up. What you can have instead of milk, you can swap it for double cream, and it's absolutely delicious. Unfortunately, I'm dairy intolerant, so I can't have double cream, but most people can, and you can put a little in your coffee and you would thoroughly enjoy it. Now, people say, how about fruits? Because people feel fruits are healthy. We have that mantra, 5 a day. Look at this. A banana, just a medium-sized banana, is equivalent to 5.7 teaspoons of sugar. That's what your body sees it as. And we have grapes. Those are nature's sugar bombs. You know, one thing about fruits that you have to remember is bears, when bears are about to hibernate, you know, they would go to a fruit tree and they would eat all the fruits on the tree. Why are they doing that? To fatten up. Bears are mammals just like us. If bears are eating fruit to fatten up, to go and sleep for 4 months, now we're eating fruit every day. Some of us are having 5 portions of fruit. We're never going to lose the weight because we don't hibernate. And, you know, because of how small the world is, we can have a mango every day of the year. Our forefathers would eat like mangoes when they're in season, pineapple when they're in season, but now we can have mango and pineapple every day if we want. So fruit is very, very, very tricky. and we shouldn't be having smoothies. Right, okay. So what are the benefits of therapeutic carbohydrate restriction? As I said, your hunger goes away, you eat less often, cravings for sugary foods and carbs go away, skin tags disappear. Honestly, they absolutely do. Your skin just becomes so much better. They actually do drop off. Your weight loss starts initially when you get rid of all that onboarded water and sodium. That like maybe within the first week of like therapeutic carbohydrate restriction, you can lose like 2 kilos because you're shedding all that extra water. But thereafter that, it's about 0.5 kilo per week, and it just continues that way. Absolutely. So true. Your belly fat starts to reduce. So normally it's, especially in the men, they tell me that, oh, I had to put another hole in my belt and that kind of thing. And the tummy starts going down. That's the first area. And that's because you have the unhealthy visceral fats in your stomach. Your blood pressure and your blood sugar starts to normalize, and that can happen very, very, very quickly. Cholesterol levels and cardiovascular disease improves, inflammation reduces, and your pain improves, your energy and your mood increases, and your cognitive function, you know, the brain fog, you know, when you go to the kitchen and you want to say microwave, but you say dishwasher and that kind of thing, that all improves, absolutely. And you get improved sleep, your eyesight improves, and there are just so many other numerous things that you thought you were experiencing because you were aging, they all just get better. And there are just so many numerous areas that improve. And you start feeling like this Duracell bunny here on the right. Now, when should you start? Because people feel that, well, I don't have any condition now, but you know, that's just waiting for something to happen. We don't want things to happen. I took this from Dr. Annette Bosworth's presentation on YouTube. I follow all these lifestyle doctors who talk about low carb and therapeutic carbohydrate restriction. And can you see, even babies and children, when their blood sugar is up, they start suffering. There's irritability. I've just circled a few of them, childhood obesity. So these are children, gut dysfunction, gastric reflux. So many people come to me and they have that problem. And when they start the program, it goes away overnight. Type 2 diabetes, dementia, we've mentioned, autoimmune disorders, all of them just, you know, just get better amazingly. Osteoarthritis and all the other things. So you get there, there's never a bad time to start. Some of the low carb doctors online that I follow, they have children babies. Their mothers were low carbers, and when the baby was born, they've just started feeding them with low carb food, and the child's doing absolutely fine. So anytime, you can start anytime. How can I check I'm doing it right? So some people don't want to measure anything. You can use your belt, because as you add more holes to your belt, you know you're losing the weight. I often recommend body composition scales, because sometimes your weight goes up and you think it's fat, but it's probably muscle, because this therapeutic carbohydrate restriction is muscle sparing. You will lose the fat and you will maintain your muscle and even increase your muscle. You can check ketones in your urine, and that's when you burn fat as fuel, you start producing ketones in your urine, and then you can use high-tech approach. And I just absolutely love using the glucose monitor. Anytime I get a free one, I would use it. And also there's a link for you can get a free trial from Abbott Pharmaceuticals if you've got diabetes. So medication adjustment, absolutely important, very, very important. And that's why it's really good to get someone to guide you, especially if you're on medication. So there are certain diabetic medicines that if you start therapeutic carbohydrate restriction, you need to stop them right away. And then also, apart from stopping them, there are other ones that you might eventually have to reduce the dose because you would no longer need it. And I've supported people who've actually come off their insulin. I've supported people people with type 1 diabetes who have actually reduced the amount of insulin they need. And and when you reduce the amount of insulin you're injecting, you lose weight. So, and you just feel great. So, you know, it's for type 1s and type 2s. Now, blood pressure as well, your blood pressure normalizes very, very quickly. And therefore, you would need to monitor your blood pressure twice a day and take a note of it. Because as the blood pressure comes down, the medication becomes quite strong. And then I would advise you to go and see your doctor and show the doctor your results. And then they can start reducing your blood pressure pills. And there are signs that your blood pressure pills are too much. For instance, feeling dizzy, lightheaded, fainting, feeling faint, blurred vision, feeling sick, and all that kind of thing. And also, I've worked with people who are not even on blood pressure pills, and their blood pressure has dropped and they have experienced all these symptoms. However, you know, their body gets used to the lower blood pressure and then they're fine. So who can do it? What age? It doesn't matter how old you are, as I said from before. So here, my oldest client I've worked with is my mother, who I fought with for quite some time to get her to follow the diet. Last year, look what happens. She had heart failure and her renal function was very poor. She had kidney disease, and within 2 months of starting, within 2 months, her heart failure marker improved by over 50%, so that she was no longer deemed to have heart failure. Her kidney function also improved, but the problem was the symptoms didn't improve straight away. They took much, much longer to improve. So the biomarkers improved, and I was absolutely over the moon. That day, I was so excited, I could barely work because, you know, it was so amazing to see the improvement. And then in April of this year, her cardiologist stopped 4 of her medicines. I was just so happy for her. And my youngest client it's my 10-year-old nephew, and he was a bit chubby, but he liked sports, and he used to get really tired when he was running, and his mother put him on the program, and he lost 4 kilos. And, you know, now he used to be goalkeeper, but now he's playing as a defender. So it can, you know, it can benefit any age. Now here, this is a real life example of one of my clients' blood pressure, and it improved over 3 weeks. And just have a look at that. He started at 148/93, wasn't on any medication, and he came down to 108/66 by just adhering to the lifestyle and the therapeutic carbohydrate restriction. So there's a lot of myths about carbohydrate therapeutic restriction. We won't go into them there, but I've put them down, and I can help people through all these myths that other people put online. And a lot of it is also the food manufacturers. They don't want anybody to be practicing this because they're going to lose money. No one's going to buy their cereal. No one's going to buy their processed foods anymore, because you're just going to be dealing with foods that come from the farm. Okay, so here are some examples of meals that my clients and myself have shared. So the first one's just sausage and vegetables. They did just look so nice. The second one is cauliflower rice and I think that's fish, fish gravy. And then the other one is just eggs, avocado, and vegetables. Here we are, we have some grilled mackerel and stir-fried veg, and then we have some cabbage, avocado, and I think that's grilled fish again. And then last one is tuna salad with chicken. Now, these are some African foods. So I work with people in Ghana, and they can be very, very creative. So the first one is what we call cabbage swallow. Now, you know, Nigerians, anything you don't have to chew is called swallow. So we use cabbage to make our fufus and our, you know, our bankus and things like that. And we can continue to eat them with our lovely soups and stews that we have. So you won't be missing out on that. Absolutely, you'll find a substitute. And then a friend of mine in Ghana made a low carb ball of kenke. Now, the picture on the right is just that, you know, if you're going to practice therapeutic carbohydrate restriction, you have to be very, very organized. So you have to food prep, because when you're out and about, it's very, very difficult to find low carb foods. Okay, so these are my final words. Medication adjustment, very, very important. You'll have to consult with your GP as your condition improves. Do your own search. Persevere. The beginning is difficult, but the side effects are very short-lived. Seek out a support group, low carb community. Be patient. The best weight loss is one that comes up naturally and slowly. Make small changes so they can be sustained. Food prep is key. And as you get used to the diet, only eat when hungry. You don't need to eat 3 times a day. Breakfast is not the most important meal of the day. That was conned by Kellogg's when he made his cereals and he wanted to sell them. What's the other thing? Okay, therapeutic carbohydrate restriction is only contraindicated in metabolic conditions, and you would definitely know if you had one by now. So I want to finish shortly. So this is just a table of people I helped. I compiled this in November 2021. And I think the beige, the people in the pink groups of people are in Ghana. You can do therapeutic carbohydrate restriction anywhere you are, no excuse. Ghanaians do it well. And you can see I put here the length of time they've been doing it. And now it's a bit longer because I did this last year, and most of them, I'm still in touch with them. They're still following the diets. And look, for 3 years, someone lost 13 kilos and kept it off. I mean, which kind of diet can do that for you? There's a lady, she had been on it by then 2.5 years. She'd lost 30 kilos. I just want to also just talk about this lady here. There was a lady here. Okay, she said 137, but when she actually started, oops, I need to go back. Hang on 1 second. Just go back previously. Yeah, so this lady, I'm going to read out her testimony to you anyway. She actually lost about 50 kilos on following this diet. And let's just go to the next one. And here are just some pictures of friends and family who've shared their pictures with permission for me to show, you know, the difference once they started. This lady here on the right-hand side, she started in June. She is just so happy. And she keeps saying that she wants to find me clients. She's so happy of the transformation. She used to eat once a day and it didn't work. And she came to me with an open mind, tried it, and now she's a changed person and she just loves her new form. Okay, and here are some more. The lady on the top left-hand corner, she's a caterer, and she lives in Ghana, and she cooks amazing meals for all sorts of people, but she doesn't eat them, and she sticks to the low-carb lifestyle, and she is just so happy. Okay, here's a lady here in the middle, top middle, March 2021 to January 2022. See the transformation. And here's a young lady here. She lost 16 kilos. And it works so fast in the young because they're so metabolically flexible. It's we, the older ones, that it takes us much longer. Again, here's a dear friend, lost 20 kilos over 3 years. She relapses, but gets back on the bandwagon. And here's a lady who lost 10 kilos in 3 months in May to July 2021. She was over the moon, and here's her graph right here to show the weight loss, which was gradual and she just feels fantastic. And here's a man, he played tennis daily for 7 years, no change, and went on therapeutic carbohydrate restriction and lost his belly fat and 7 kilos in 4 months. Absolutely fantastic. Right, so call to action. Do any of these apply to you? Are you overweight? Is your blood pressure over 130, over 80? Do you have high blood sugars, out of range liver function test, high triglycerides and low HDL? Skin changes, chronic pain? Then this is what you need to do. Carry out your own research. Reduce processed foods and added sugar. Start intermittent fasting if you can't do anything at all. It's very difficult though if you are not fat adapted. Try some low carb meals, join a Facebook group, or enroll on my 8-week program, my lifestyle. Absolutely fantastic. I'm getting so many results. Right, here we are. So what you get on my coaching group is you'll get one scheduled 45-minute initiation orientation phone call, because I need to make sure that you're safe, you're not on any medication, you're not going to put yourself at risk. And then I have to make sure that your goals are realistic. And then towards the end, I'll call you again to speak to you, but within that time, probably we'll be in touch anyway. I'll give you weekly instructions on how you can make gradual dietary changes. I'll give you education on nutrition and the evidence why we're doing this. A lot of what I tell you goes against the grain, but I have all the evidence to support, and I have the evidence of people who it's worked for. I will teach you about metabolic syndrome, why it matters, how to fix your poor health naturally, what blood tests you need to take and track and why, what foods will help you control your insulin, and how the different food groups will affect your well-being. We'll talk about basic supplements, and I just mean basic supplements. It's not a whole host. I don't sell you anything. I'll give you recipe suggestions to suit your heritage, and what eating plan will best suit you. And I'll teach you how to track your progress to keep you safe, and tools to maintain your improved health. Okay, so I'm going to read this really, really quickly, and then I'm going to get someone to come and speak to you about their experience on the course. So I've known Effa since 2020 at the peak of COVID and the rollout of the vaccine. She did a presentation for the Ghanaian Union and my church, and we got talking about chronic diseases such as diabetes and high blood pressure. We also spoke about inflammatory conditions and some neurological conditions. She spoke about how carbohydrate or protein diet can help reverse such conditions. This also sees you losing weight and becoming more active, hence improving your physical activities. The science of intermittent fasting was also explained. My journey towards my health and well-being started then. At my heaviest, I was 150. I am now 102 kilos. I would have lost more than this, but when I became unwell, COVID, I started eating what I could tolerate, hence setting me back. I realized I was justifying why I had turned back to previous no-no foods and delay my progress. But Effa was always there to encourage and motivate you to carry on. I am now religiously doing intermittent fasting and eating once a day, which is more than enough to keep me. I know that if you are not hungry, you just don't eat. The program is so effective that my immune suppressant medications have been stopped. I am now taking low maintenance dose. My scans are normal. I do not take any more steroid treatment and not on any diabetic medication. My blood sugars are all within normal range. I still do take 3 different medicines for my autoimmune condition, very low dose and high blood pressure, a huge reduction from what I used to be on. I know this will stop within the next 6 months as I continue to lose weight. Right. My GP and practice nurse tried to tell me it's not a good diet to follow. It is a shame that the medical teams are stuck with pumping medications for us to take. And yes, they are working with protocols, but disease management has changed and they need to work with changes and accept patient choices if it leads to disease remission. Okay. So I'm done. Sorry, it's been so long, Nana. But can I just call Kweku to have his little
right?
spill?
So if we can have Kweku for a few minutes, just a few minutes. So we've gone past 8, so we have the rest for others to ask questions. I've seen a lot of people keen to want to say something. So if we can let Kweku in quickly, and then we'll take a quick break, and then we'll come back for Q&A.
Thank you.
All right. Can you hear me?
Yes, we can.
Yes.
All right. This is where I want to start from. I know Effa as a friend. So in many ways, when my health problems started, I know she was a pharmacist. I didn't see where this was going. And then we started talking. But let me tell you something about Effa. She's voracious. She's a lioness. She will track you down. She will make you do the things that you have never ever thought you wanted to do. And Effa, I hope you don't mind. I'm just going to share. At that moment in time, before that, I was having an issue with child custody. Effa sat me down and told me to get off my high horses and prioritize my daughter.
Kweku, we need to focus on your health, please.
I'm going there, but I need to put everything in context so that people know how your influence is far-ranging. And that was the first time that made me sit down and take a look at Effa again. So the next time I have diabetes, and okay, but then every now and then me and Effa talk. I mentioned I've got diabetes, and she was like, you need to do this, you need to do that, you need to do, and I'm like, what the hell? But then I never forgot the impact she had on me regarding my daughter, who is the most precious person in my life. So I followed reluctantly, and this was it somewhere between 2020 and 2021, or was it 2021 November? Because by then I got admitted to diabetes specialist care outpatient unit. And she actually showed me how the keto diet, low carbohydrates or no carbohydrates, can help. I participated in the program. I made great recovery. And I got discharged from the clinic because when I got tested, everything was fantastic. It was like I'd recovered. And I mean, some of the specialists couldn't believe it. And that was put down to lifestyle changes. So because of lifestyle changes, I was discharged. But the guru behind the scene was Effa. And then once I was discharged from the clinic, what did I do? I go back to my old ways. I'm ashamed to admit it, but I did. And it was earlier this year, somewhere between April, I noticed I couldn't see. I was struggling to see. In fact, I was going black. It got to a point where I couldn't work. And I've never been in that helpless situation. I'm not that kind of guy. I always know what to do. I always have a plan B, a plan C, or a plan D. So I was in an unusual situation. I went from one health professional to another health professional. And then Effa And I started talking. And she was like, go back on the program. Did you go out of the program? And I had to admit, yes, I did. So I went back on the program. And I'm happy to report things are slowly coming back into place. My vision is coming back. I'm beginning to see. So whatever is purporting over here on this platform, for those of you guys, I mean, maybe some of you don't have health issues and you're just interested in tapping in here. But for those of you who have health issues, believe you me, it makes a changes because one, I got discharged from diabetes clinic. Second time around, my vision is back, but now I kind of have to wear glasses to see. But even then, I mean, I'm beginning to see sometimes I don't need the glasses. And I'm actually walking without glasses and I can see things like number plates. And I lost that ability. So I just want you to all know, and it doesn't take much. It's just some small modification to your diet.
Right.
Rather than add the banku in the okra soup, just eat the okra soup. It's as simple as that.
Thank you very much. Thank you very much, Kweku. This is a good experience that you've shared, and it goes to testament of Ifa and the work she's been doing for many, many people who have benefited from her service. We are here to, with all the education we've got, can just imagine how much it will cost. Nothing other than you continuing with it and making the best out of it. We'll take a quick minute break so all of you can take a glass of water, wherever, and then we'll return. Please raise your hand, ask questions, because if we don't, we will just obviously assume that everything you've heard is great and you're going to go and do the right thing to help yourself and your families. We'll be back shortly.
Boss in Europe. Let me join Tap Send.
That's because I'm in Spain. I'm in Madrid. Oh, and Tap Send is having a double referral bonus promo. You don't know. That's why I'm here. So me too, I'm going to refer people in the USA and I'm going to get double my promo bonus. So meaning if you're in the USA, you can also refer people in USA and you'll get double your referral bonus. If you're in Canada, you can do same. If you are in UK, you can do same. If you are in Europe, many countries in Europe, you can also do same. So join this promo, and this promo starts from now, my brother. Don't go, and it's double the promo bonus.
Download Tap Send now on Google Play and App Store. Tap Send. It's secure, convenient, easy, and fast.
At Diaspora Insurance, we understand the importance of dignified send-offs within Ghanaian culture and traditions. We also understand that you want to avoid the double trauma of your family grieving and not having the financial support. With our Diaspora Funeral Cash Plan, you can now cover yourself or your family in Ghana or abroad. With no medicals required, we'll accept you if you are under 75 years. Visit our website today or call us to complete a simple form in under 5 minutes. With Diaspora Insurance, your peace of mind is guaranteed.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Are all student association contributions?
Even the money from the fundraiser for Kweku's surgery.
Oh! He too? Don't be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
Uncle, my father is hiding under the bed.
Oh, Araba.
Chango for your groupings and crowdfunding.
Welcome back. Tonight, we've been going through what you can do to improve your metabolic health. This program has been put together with the help of Ghana Nurses Association UK, the Ghana Union UK, the Western Region Association of Nurses UK, and of course, the Ghanaian Nightingale Nurses UK. This is a health program. Today's topic has been about health, and I hope you would all find a minute or two to ask your questions, share your ideas with us. We also want to thank TapTap Send for their support, bringing you this program wherever you might be. They are the one helping us to do so. And of course, IT Consortium and Diaspora Insurance. My name is Kwesi Kwasin the First, and I'm the chairman of Ghana Union. Now, we have no hand up, which is a good news, but that will simply mean that I will be asking some of the questions that I got prior to the forum. Now, I'm sure you've gone through some of this, but most people too this would have been one, the earlier stage where they wouldn't maybe hear some of the things that you've said already. And I'm going to just repeat some of the questions. How can you tell if you are obese? Because sometimes some people don't feel they are, but they are told they are. How do you identify what makes somebody think of themselves as obese? Is it just somebody pointing finger, or there are some signs that you need to follow?
Okay, so when it comes to obesity, we have the BMI, but that's not very good for Black people because we are built differently. But I did go through how you can tell if you're obese or have insulin resistance by measuring your waist and multiplying the number you get. And if that number is shorter than your height, if that number's higher than your height, then you are obese. So remember, you measure your waist, multiply it by 2. If it is higher than your height, then you know you are obese or have insulin resistance and you have to do something about it. You can also see signs on your skin tags or dark patches of skin here and there in your groins. That shows that you have insulin resistance and you have to do something about it.
So if your waist is about, some people have been talking about size, 8 times 2 or 16, right?
So your waist,
how it works?
No, so if you're a woman and your waist is about 35 inches,
right? Okay.
Yeah, then you definitely have insulin resistance. If your tummy is like an apple, you have a big tummy compared to the rest of your body, you have what we call visceral fat. You have fat in your liver, you have fat around your organs, and that's a risk factor for cardiovascular disease. Absolutely. And when you reduce that, then your risk goes down.
So today, some of us, the men that have been wearing suit like I do occasionally, when you come button your suit from the time you bought it.
Yeah, someone told me an interesting phenomena. He says, when you look down as a man and you can't see something poking out, you know you have a problem and you need to do something about it.
Right, okay. We got a message. Right, okay. So at what age should one be more worried about their blood pressure? Some doctors have been saying, oh, it's okay, you are within that age where it's okay, it's not too bad. And they don't actually make you realize the severity of the situation. They just give you the medication. These days, 2 minutes, they want to get rid of you from their surgery. what are the ages where these things tend to happen?
So everybody is different.
Right.
Everybody is different. What does health mean to everybody? Everybody has their own measure of health. If you're not feeling healthy, you need to do something about it. And as I say, it's never too late or too young to start. We need to teach our children to be more healthy, because what our children are eating worse than what we did when we were children. So that means that their problems with metabolic syndrome is going to start absolutely sooner than ours will start. And I read somewhere that our children are going to be the first generation of people who are going to live less long than we would. You know, their lifespan is going to be shorter than ours because of nutrition and the food we're eating and they are eating now. So it's never too early to start. And I wouldn't say just do it for yourself. Change your family's diet so that you're choosing more healthy substitutes, rather than, what we're used to. And the processed food has to go. Absolutely.
So when you say processed food, like if I were to be coming off fufu and all the time, and I start eating more salad from Tesco and all that, would that help, or is it something I have to do by myself and all the time?
I wouldn't say that. I would say like the breads, the flour, the grains, the rice, and those things. Rice is too polished. There's no fiber. It's just sugar. Goes straight to spike your blood sugar. And if you have a problem, you need to work on it harder. I know there was one question here, so can I eat banku and okra and things like that? Yes, we love it, but we should treat it as a treat, not an everyday meal, especially if we have metabolic syndrome to reverse.
I see. Okay, I've got two people's hand up. I will go to them and I'll come back to you with the rest of my questions. I've got Malcolm Fair, please. Dr. Malcolm. Let's go straight to the point because we've got only 30 minutes left and I want as many that want to ask questions to do so. Dr. Malcolm, if your hands is up,
yes,
please.
Can you hear me?
Yes, I can hear you. I can hear
Hello,
you. Yes.
How are you?
Hello. I'm fine, thank you. Nice to see you.
Nice to see you. Thank you. Just a quick question, or two actually. Firstly, you mentioned about rice. And as a diabetic, I've been through all this and unfortunately it's no longer reversible. But they say that brown basmati rice particularly is a rice that is, is acceptable. That was one question. And the other question was, why are you saying that the bariatric surgery is dangerous? Because that's something that I'm not so, I'd like to just ask you a reason for that, please.
Okay. So with brown rice, remember I showed you when we compared white rice to brown rice, your body, so white rice was about 9 teaspoons of sugar and brown rice was 7-point-something teaspoons of sugar. Your body doesn't know when the sugar comes in, it doesn't know where it's coming from. All it needs to do is metabolize it and it will break it down into sugar and your sugar will spike. So that's the thing about rice. I know people say brown is better. Yes, but what do you want to achieve? What is your health goal? Your health goal, it will be completely different from what your GP's health goal will be. Now, when it comes to bariatric surgery, I say it's dangerous because any surgery is dangerous, and bariatric is like, they're cutting your guts. It's major surgery. Any surgery is dangerous, and especially if you're overweight and you have surgery, your risk of infection is so high. Your risk of recovery is worse than someone who is not overweight. So it's just the side effects from the surgery, really, that I'm talking about. And I know a lady, the children, they used to go to school together, and her husband had bariatric surgery, and she told me he nearly died. He was on ICU. It's not a risk-free surgery. And many surgeries are not, but especially bariatric. But then again, it depends. If they're not doing the sleeve, they're not cutting your tummy, and they're putting a balloon in, maybe that's not as risky as when they're opening you up and then trying or using the staples on the stomach where you can get infections. So, you know, every surgery comes with risk. And that's why I say it's more risky than trying therapeutic carbohydrate restriction, isn't it? You can look at it that way.
Thank you. Thank
Yeah,
you. Unique Mama. If you want to ask a question, you can, and you don't want to be seen, just unmute yourself, put your hand up, and you don't have to show your face if you feel like any reason why. I want people to ask questions because it's very important. Unique Mama, please, if you can unmute yourself.
Oh, good evening, everyone.
Good evening.
My question is, at the moment, I've been put on anticoagulant because I have blood clots.
Yes.
They are telling me not to eat cauliflower and greens and all that.
Yeah.
So
okay.
If you are saying we have to substitute rice for cauliflower rice and all that, how do I go about it?
So with your condition, because you're on an anticoagulant, are you on warfarin or the tablets? Hello, Unique Mama, can you hear me?
I think once we ask the question, we normally mute the person.
Oh, okay, I see.
So if you can explain in general.
Yeah, okay, so well, yes, if you are especially on warfarin, having vegetables does influence your INR, when they measure it to see if you're within range. However, what we would say is if you are changing your diet, you'll probably need to have more frequent blood tests. And then once your diet is changed, you would need to stick to that same diet. So you will not eat the cauliflower and the broccoli and blah, 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 like this week. And then next week decide you're going to go back to something else because you will have fluctuating INRs. So you would need to have more frequent blood tests so that when your blood is stabilized, then we know where you are, and then you would need to stick to that diet. And then probably your blood tests won't be as frequent as before, so that they know what dose to give you. So that's how that works.
Thank you. We did hear, testimony from Kweku, and Dr. Malcolm also said he's got a stage where it's no longer reversible, if I'm correct. So is there a situation like that that cannot be reversed no matter what you do?
Well, you see, this is the situation here. I told you that the NHS does the low calorie diet, and the people who are allowed onto that program have to only have had their diabetes for up to 6 years. However, Verta Health in the US, who work with all patients who have diabetes, they've had patients who've had diabetes for over 20 years. And they have managed to get them off insulin. It has taken a while because sometimes the pancreas is burnt out, but they have improved their health. Now, for me, I don't think there's any age limit of which you cannot improve where you are. So let's say you had like kidney disease and you are at stage 2, you can bring it back to stage 1. If you're stage 3, you can bring it there. There's always room for improvement. There's no point in continuing on the wrong diet when you can change your diet. And, any level of improvement is an improvement that will impact positively on your health. So I would never give up. I would always attempt it, and probably you would be surprised with the outcome.
Thank you very much. Councillor Bosman Kwashi, please. If you can unmute yourself, Councillor.
Thank you, Honourable. Thank you so much. And this is a brilliant platform to hear all the information. Thank you so much. My question, and maybe more so a comment, is about the many UK Ghanaian diasporans that are here in the UK, and we're told to we have a different lifestyle to maybe what we have that we're seeing back home, and how do we adapt to our eating habits, sleep, and information that we're given, because obviously sometimes some medical professions, even when you say you feel you might have an issue concerning your health, they might misdiagnose you. So what types of information can we try as a community, I don't know, to break some of these barriers? And I also feel like when we look at, the men in our communities, sometimes it's often harder for them to also reach out for the support that they need. And we are seeing a decline in how long we're living in the UK. So I'm just wondering if you had any kind of advice on that and what I can do in local government to help in the health sector. Thank you.
Well, thank you, Councillor, for joining us. And I'm sure there are any ways you can help with any dissemination of information is the right place to be. Ghanaian Community Awareness for every 2 weeks. But Ifa, please go ahead and if you have anything to add to
Yes. So when it comes to healthcare, I'm a member of a charity. It's called the Public Health Collaboration, and they promote real food. We are really trying to work hard to get the government to change their guidelines, especially the nutrition guidelines, that the Eat Well plate doesn't work well, especially if you have metabolic syndrome. So there are bodies that we're working really, really hard. And some of these doctors and clinicians that I'm on a group together with, they are also trying to change the way they treat patients in their surgeries. Currently where I'm working, for 4 years now, I've been asking them to try lifestyle, and they've finally given me the go ahead. And I've started working on a pilot within the community, with the GPs in Haringey. And hopefully, if that pilot is successful, it will be rolled out. So people are working really, really hard. But Councillor, you have to understand that we are working against the food industry, the pharma industry. They are all in it for their own benefits. Nobody is in it to keep us safe. Everybody has a financial interest. So it is really, really difficult. But, there are people around working really hard to try and change these guidelines. And if there's anything you yourself can do, that would be very welcomed for the support.
So there's something I wanted you to see if you can help. Does our specific background as a community, as ethnic minority group, are we susceptible to certain conditions of health that become generalized? Because most often doctors will turn around and say, oh, because of where you come from and the kind of background, you are more likely to be in this category. Is it that something that's
Yes, absolutely. I would say genetics is a factor, that there have been some healthcare inequalities, which we're trying to work on. Like, for instance, before the George Floyd thing, when you went with your kidney function and it was a bit out, they would add a factor to it saying that, well, for Black people, they're used to having high kidney function, so multiply it by this factor and it brings it down. And therefore, it puts you at the end of the list when it comes to dialysis and things like that. But we are working really hard in the NHS. I'm part of the NHS, and we're trying to deal with the health inequalities to support people. And it's one of the things, that's why I'm trying to work with the Black community to get them, because in the space I work with, the Public Health Collaboration, and the people I follow and I meet, I don't see many Black people who look like me, and I feel I need to carry this message in our community because I've learned about it. I've educated myself over 5 years and I've become very, very knowledgeable. So I'm working really hard. So if you want to reach out to me so I can speak to other Black communities, I would be very willing to do so, to try and help and improve our health. And it's not just here in the UK, it's in Ghana as well. We hardly have any dialysis units, but about 1 in 4 people with hypertension have chronic renal disease. It is a big problem. It is a big problem. Here we have the healthcare. If we're sick, they'll treat us, but in Ghana, it's not like that. So I really want to reach out and get this message out. People can do it on their own if they find it difficult. I am here to support as well. And I've got many successful clients who are so grateful for having met me and picked up the message and follows it through.
Thank you. I see Dr. Malcolm's hand up again. Could we let him in to ask a question or comment or add anything that he might want to?
Okay, sorry. Thank you for letting me come in again. There was 2 points. Effa mentioned earlier about the changes in our children. I work with a charity called Smile for Ghana, have done for about 5 years now, and I'm a registered dentist in Ghana. I've been going to Ghana for nearly 30 years. In fact, I have Ghanaian residency now. But I have noticed over the last few years quite a distinct difference in dental health, which is linked to what Effa's been saying about our refined diet and our processed food. You get the generations where there are some problems, admittedly, broken teeth, gum issues, but the amount of dental decay has accelerated in the certain age groups. In the 20-year-olds and the teens is not what you see when you look back a generation, and it's quite specific for processed food. I'm just sort of going, just trying to support what Effa is saying. From a dental point of view, it is, I see it every year I go. I see it, it's quite noticeable, and it just supports what you're saying about a generation that we're going to have.
Yeah, absolutely. We need to educate our families and our children. There's no two ways about it. We might think, we're doing them a favor by giving them the food they want, but dental health is so important, right from a child, they have to start chewing and eating real food. It's so important.
So I go back to that question. Thank you, Dr. Malcolm, for adding that. Your experience in Ghana, very valuable. If you have any areas you think you can appear on the forum and share with us, I'll be more than happy to do that and have you on, especially when you're
Nana,
talking about...
I picked up some questions from the chat, so
Right.
I want to go through them. So someone asked whether salt or sugar was bad for the health because they thought salt was worse. But absolutely no, it's not. It's sugar. When people start my program, I encourage them to take more salt, actually, because our bodies do need it. A lot of people who are on low salt do not do well. They start feeling weak, especially because as their insulin goes down, they start peeing out more fluid, and then their salt levels go down. So they need to replace their electrolytes. The second one was, then someone asked about the 16-8 intermittent fasting. Absolutely fantastic, and I would encourage, if you can push it to 6-18, even better. Some people eat once a day. We call it 1 meal a day. OMAD, absolutely fine. If you're trying to control your insulin, that would be great, but you must eat the right food whilst you're doing it. Someone asked whether does that mean they can't eat banku and kinky ever again? And we do have substitutes that you can make with vegetables, which will definitely satisfy you. You can have your soups and you'll be very, very happy with it. Someone talked about potassium wasting medicines, and that's absolutely right. If you are on diuretics, some of them make you pee out potassium, and a lot of diuretics can also cause diabetes. So, when people say, yes, well, we can have a pill for blood pressure, there's so many side effects associated with it. You're better off controlling it naturally. One other thing I want to say, that the drug company and the pharmaceutical companies, they're all in it for their own, agenda. They want to sell us something, they want to make money, they're not looking out for our own health. We need to take our health into our own hands and sort ourselves out. Are there some more questions?
Okay. Right, I have a question here somebody sent me earlier, asking, do certain types of jobs increases the risk of heart disease? If yes, what are some of these? Do you think the profession or the type of things you do puts you more at risk than others? Is there any facts around that?
Yeah, so particularly if you're doing shift work, So that can affect your, what we call the circadian rhythm. You know, when we used to be hunter-gatherers, we would go to sleep when it was dusk, and then we'll wake up with the sunlight. But now and then we have cortisol levels that rise in the morning, and it all makes your body work properly so that you can feel sleepy in the evening and that kind of thing. When that is out of whack, so if you're like a shift worker and you're probably not even sleeping very well during the day, so there's lack of sleep as well, it does put you at more risk. And there's a lot of evidence to show that, you know, shift workers are more at risk of having cardiovascular disease, diabetes, and long-term conditions. So, I mean, as soon as you can, you know, and try and sleep when you can. I know it's part of life. You can't really control it, but if you can bear that in mind and try and rest when you can, and really prioritize your health and your rest. Do not, you know, like, you know, it's church and I have to go to church, but you know, you're a shift worker. You need to look after yourself as well. So try and prioritize all these things. And when you are off, really don't go doing things that, you know, will take up your time when you should be resting. Yeah.
Thank you. Can I call on Noble, please? Noble, I'm watching. Noble, if you can unmute yourself, sir. Noble, I can see you, but can you unmute yourself? Okay. I may have to come to you just to save time. Dr. Forukwa, please. Okay. Noble is done now. If you can go ahead, Noble.
Okay. Thank you very much, Efa, for a fantastic presentation. You did mention something to do with cholesterol. I'm taking statins. Is there a means by which you can get off it, if at all possible?
Yes, so when it comes to statins, I think there's a lot of evidence that is now showing that, you know, lowering your cholesterol is not all that we need. You know, cholesterol, there's different fractions of the cholesterol. Remember, I talked about the good cholesterol, the HDL cholesterol, and then the triglycerides. As long as your HDL is good and your triglycerides are low, then you should be protected against cardiovascular disease. You know, some people like myself, I have very, very high cholesterol, but my good cholesterol is very high and my low cholesterol is very low. And because I eat a lot of lard, I use animal products, and I coach people, I actually got a coronary artery scan to see, because my doctor was worried about my cholesterol because it was high, and I have not a single plaque. The result came back as 0. So with the cholesterol, you really need to have someone to have a look at the different fractions of your cholesterol and advise you. Usually when people start low carb diets, then their cholesterol improves even further and the triglycerides drop. So it's not all about just the total quantity, but about the different fractions, and there's even more nuance to it. So you need someone to have a look at your cholesterol, and then you can make that decision. And the GPs do have a cholesterol prescribing decision aid, and they should be showing that to you, because out of 100 people who take that tablet, you get, like, I don't know, 10 people will suffer from the side effects and only 3 people will benefit. So you need to have that discussion with your GP. You need to ask your GP to show you the cholesterol prescribing decision aid and explain it to you. And then you can make up your mind as to whether you want to go on a statin or not. Yes.
Thank you. Dr. Forukwa, please.
Hello, madam. Very good presentation.
Thank you.
It looks like our human body is not very efficient at burning calories. I do 30 kilometers on the exercise bike on Saturday mornings, and all that only burns about 1,300 calories. That's about 2 bowls of cereal. So it doesn't look like our body is very efficient, is it?
Well, that's a very, very good observation. But I will just tell you that our bodies are so unique, and it's not about calories. It's not about calories. We are not a chemistry set. It's about our hormones. It's about when our body sees like 100 grams of broccoli and 100 grams of oats, it's going to tackle those two different foods absolutely differently. So it's not about calories in, calories out. We need to start thinking about our hormones and how our hormones respond to the different foods we take. So our bodies are so unique. And maybe we can talk off air about you doing all that exercise, because it's really not about the amount of calories you burn. On my program, I tell people to eat until they're satisfied, not to count calories. We don't count calories, and your body will regulate itself and you will lose weight despite the fact that you're eating until you are comfortably stuffed. People who eat like salads on my program, I'm like, are you full? If you're not full, don't be eating salads. You need to eat something that is nutrient dense, and then you will be full. And then your body will tell you that I don't need to eat for like 18 hours after. So yeah, we can talk about this later. I hope you've copied my number down so we can discuss your exercise routine. Thank you.
Thank you. May I say that all our programs are recorded, and all the recordings are on Ghanaian Community Awareness Forum on Facebook. Anytime you want to go and check any program we've done since February 2021, they are all there. Every 2 weeks, they are there. You can go there and have, play it back, and then you can understand anything. I'm sure if it takes a lot of clients personally, and I have to say, I've signed up to one of her courses, which I'm just about 3 weeks into it. This suit I'm wearing, I've had it for a long time. My bottom used to be very, very tight, and now I can wear it at ease. So I'm trying it out so I can give more evidence. I'm not here to market, but I'm here to also tell you the good news. If you can spare 8 weeks reasonably, please find a means to contact her. And, I'm sure you make a difference to yourself and your family. There are so many medications out there. They will give it to you. It's the easiest option, but not all of them will do us much good in the long term. So let's take a step as quick as we can before things get too late and out of control. I say this, that I'll have 1 or 2 questions before we close.
Okay.
The next program we have, it will be about education again. Most of you will know for 5 years we've had free SHS in Ghana and everything else. I am hopefully trying to get hold of personnel from Ghana Education Service to come and talk about free SHS, where we are, how far it has benefited the country, and all the other things. I'm yet to agree that the topic area with them, and as soon as I do over the weekend, you will see the flyers coming up. I thank all the audience who have been faithful to us and steadfast and being with us throughout. Your time here is valuable, and we appreciate your continued patronage of this forum. Now, can I ask you one question or 1 or 2?
Okay.
Stroke has become a commonality amongst a lot of us. And the science doesn't seem to ring bells to so many people. Do you, as a pharmacist, have any sign indicators that you can give to people? Because a lot of the people, they go to GP, they will tell them, you need to take this tablet, or otherwise be prepared to have X, Y, and Z. And stroke tend to be one of those things they tell you. If you get a doctor that wants to be upfront with you. What are some of the signs of stroke?
So are you talking about the fast reaction or how to prevent it?
Both will do. Any insight you can give on both areas, fast reaction or
so fast is your face, isn't it? Your face, you have to look at the person's face and see if there are any muscle changes. So like a drooping mouth. And then A is for arms. You put your arms up, if they can't put both arms up, or one arm's not going up, then there's something wrong. And then there's the smile, if they can't smile like that, a lopsided smile, then something's going on. And then T is just time to call an ambulance. Right. Now, to prevent stroke, you just need to control your blood pressure. That is absolutely, and one of the problems in our communities are that, blood pressure tablets blood pressure brings your blood pressure down, and it affects libido. I mean, that's the problem. A lot of our men don't want to take those tablets. And when you're not taking it, your blood pressure is not controlled, so it's a vicious cycle. You don't control your blood pressure, you're putting yourself at risk of having a stroke. I know the Caucasians, they have more heart attacks, and we Black people have more strokes. So important to control your blood pressure. If you don't want to take the pills, do the therapeutic carbohydrate restriction. It is so effective in bringing your blood pressure down. Absolutely. Yeah, do not joke with it. It is really serious. I cannot stress how serious it is. And the number of men I meet who their blood pressure is high, but they've been living with it and they don't really care. It's damaging your kidneys. And you think now you're busy. When you have to go for dialysis, that's 3 times a week. I laugh and joke about things, but it's a really serious thing we really need to consider in our community. We need to sort out our health.
Thank you.
Yeah. Okay.
Ife's number is on the screen, on the chat room, those of you who can access the chat. But the number is 07484 785 566. 07484 785 566. Please make a move before it's too late if she can help you and your family in one way or the other. On that note, we want to thank Ifa for your time. This knowledge you've shared with us is valuable. We cannot, no amount of money from us can buy it, and we are grateful. Wherever any topic you have and you want to share with us, always know that this forum, you are part of it. You've been part of us when we started and when we were talking about vaccines, and now we are talking about how to improve our health. So any tidbits you have, we are more than happy to welcome you. We want to thank TapTapSend, Diaspora Insurance, and of course, IT Consortium. I want to thank our partners in this program, the Ghana Nurses Association, the Western Region Association of Nurses, and of course, Ghana Union for putting it together. We thank Ghana High Commission for their endorsement, and we thank the audience, most importantly, audience for patronizing it. Let me not forget my IT team who are behind the scene, Paul Akwabwa and Linda of Access Media. They can put together all these sorts of, initiatives. You don't have to be having face-to-face meeting anymore if you don't want to, and they can help you generate it nicely and do other things, putting up an event together and all that. Paul and Linda are great. And I couldn't have achieved all this for nearly 2 years without their support. We thank all of you for your time here. And may I take this opportunity to wish you a pleasant, restful weekend. Stay safe. COVID, we are told by the news, is rising again, 15% up. I'm not scaring you, but I'm just saying what the newsman said. Please be safe, stay well, and we will meet again in 2 weeks' time. Have a restful night. Thank you.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Are all student association contributions?
Even the money from the fundraiser for Kweku surgery.
Oh! He too! Don't be be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
Uncle, my father is hiding under the bed.
Oh, Araba.
Chango for your groupings and crowdfunding.
Boss in Europe. Let me join Tap Send.
That you guys, I'm in Spain. I'm in Madrid. Oh, and Tap Send is having a double referral bonus promo. You don't know. That's why I'm here. So me too, I'm going to refer people in the USA and I'm going to get double my promo bonus. So meaning, if you're in the USA, you can also refer people in USA and you'll get double your referral bonus. If you're in Canada, you can do same. If you're in UK, you can do same. If you're in Europe, many countries in Europe, you can also do same. So join this promo, and this promo starts from now and ends in October. My brother, don't go. And it's double the promo bonus.
Download Tap Send now on Google Play and App Store. Tap Send. It's secure, convenient, easy, and fast.
At Diaspora Insurance, we understand the importance of dignified send-offs within Ghanaian culture and traditions. We also understand that you want to avoid the double trauma of your family grieving and not having the financial support to cover funeral expenses when you're not around. With our Diaspora Funeral Cash Plan, you can now cover yourself or your family in Ghana or abroad. With no medicals required, we'll accept you if you are under 75 years. Visit our website today or call us to complete a simple form in under 5 minutes. With Diaspora Insurance, your peace of mind is guaranteed.